Cerebral palsy is the most common motor disability of childhood, and no two individuals will experience it the same way. Joining us during National Cerebral Palsy Awareness Month is Dr. Scott Benjamin, Section Chief of Pediatric Rehabilitation Medicine at MUSC. Dr. Benjamin, thank you for joining us today.
My pleasure.
So, cerebral palsy presents differently in everyone. Could you provide us an overview of what cerebral palsy is?
Yes, cerebral palsy is a general umbrella term for some sort of injury that has taken place to the brain in a baby fetus before they are born, an injury around birth or delivery, or shortly after birth. An important thing to understand for families and practitioners is that cerebral palsy is not a progressive disorder, so the brain injury itself doesn't change with time, but the secondary consequences of that injury can lead to additional complications as these children get older.
Okay, so the symptoms can worsen over time.
Yes, the symptoms can worsen over time, though the brain itself does not worsen over time.
Okay, and now it presents differently in every individual. It doesn't look the same.
Correct.
Why is that?
Because different areas of the brain may be affected. Okay. So there are some children who might have significant physical disabilities but actually are of typical intelligence. Those children may still have significant difficulties with speech and verbal language, but actually have normal intelligence, so figuring out ways for them to communicate. There may be children who physically are doing fairly well, but have significant intellectual disability. So it can really look very different in different patients.
So there is no cure?
There's no cure.
So what would the treatment look like?
Depending on the individual child, they are all involved in physical therapy, occupational therapy, and speech and language pathology therapy services. Many of them will have specialized education services. From a medical standpoint, a lot of what I do will be managing the musculoskeletal or orthopedic consequences of those injuries. So spasticity, which is abnormally high muscle tone, we might treat with medications, injections, such as botulinum toxins, Botox, Dysport, other brands that reduce muscle stiffness. Prescribing bracing, equipment, therapies. They will also be followed by orthopedics if surgical intervention is necessary. Neurology can help with diagnosis, but also if they have seizures as part of their diagnosis, and other specialists may be involved as well.
Does early treatment make a significant difference?
So early therapeutic interventions with PT and OT and speech and medical management can help maximize their developmental potential depending on the individual child. Obviously, some children are very severely impaired. And then preventing some of the secondary complications and consequences with early management is important as well.
And now, even though it presents so differently, is there any advice that you can kind of give overview of someone who is caring for either a loved one or a family member who has cerebral palsy?
So every child is very different, so it's hard to give a generalization of how to care for an individual with cerebral palsy. Obviously, getting diagnosis when these kids are young, getting appropriate support services in place therapeutically, getting good education from medical providers as to what the expectations are for that individual, and following through with those suggestions and accessing all of the resources that they can.
And where is a good place for our viewers to go for these resources?
So depending on where they live in the state, a lot of children will come down to MUSC for their care. There are therapy places scattered all over the state, although in general South Carolina is a little bit underserved regarding therapeutic services for pediatrics out in the communities, so that does make it a little bit challenging sometimes.
Okay, well, we will add that MUSC website link below. Dr. Benjamin, thank you so much.
My pleasure.
We're back after this.